Today on Investigate TV Plus, the sleepover debate.
I feel like it is a hot topic more than it's ever been a hot topic.
A childhood rite of passage is now considered a risky proposition by some moms and dads. We explore sleepover concerns, get professional insights, plus
Ease into it. Try one of those late overs.
provide solutions and guidance for a potential middle ground.
Then an epidemic of violence.
I've been, pushed against a door. I've been threatened. I have had a lot of terrible homophobic language sent my way.
Healthcare workers across the country face a daily danger while just doing their job. We take an in-depth look at a growing threat to those who help heal and explain the steps one state is taking to keep workers and patients safe.
And inspiring service.
Our community is part of us and we're part of them.
A former educator may run a thrift store, but she doesn't discount kindness.
In-depth stories that inform and inspire. You're watching Investigate TV Plus.
Is it a rite of passage or too big of a risk? It's a question parents face whether to allow their children to attend sleepovers. For some, it can be a difficult decision as child safety comes into play. I'm Tisha Powell.
And I'm Lee Zurich. According to the CDC, more than 90% of child sexual abuse is perpetrated by someone the family knows and trusts. So how can you make sure your child is safe while staying overnight at someone else's home?
We talk to experts and parents about guidelines and solutions to keep kids safe while spending the night away from home. At the McElrath home,
Who wants pesto? Who wants red sauce?
Pesto!
Fridays are just for family.
Star Wars, okay, there we go. Which one are we on?
After a hectic week of work and school, this family of four enjoys some quality time together.
We started protecting our Fridays. Nothing ever gets scheduled on Fridays.
Now, Emily and Chris McElrath's kids are getting older and being invited to sleepovers with friends on the weekend. But for this family,
Where do you guys stand?
With the exception of a time or two that I can count on one hand, we're in the no sleepover camp.
they say they're not comfortable with their 9-year-old son who suffers from epilepsy and their 11-year-old daughter spending the night outside of their home.
Not everybody has the same rules that we have in our household, and that's okay. I don't know what their social media policy is. I don't know if their children have phones or devices.
Or what online content might be seen by curious young eyes. As a contributor to parenting website New Orleans Mom, it's something Emily is especially thoughtful about.
And just some of the stuff that I'm already seeing kids talk about in her grade. If my child sees it, I don't necessarily get a do-over. I don't get to have her unsee it or unexperience it,
Sleepovers can actually be a massive risk for children.
According to child safety expert and former child abuse detective Christy McVie, the McElraths' concerns are valid. McVie, who has interviewed young victims on the job in Australia, says sleepovers open the door for sexual abuse, and not just at the hands of strangers.
Sleepovers at cousins, at grandparents, at other people's homes that could be family, because for the most part, child sexual abuse is perpetrated by someone known to the child.
I feel like it is a hot topic more than it's ever been a hot topic.
Even knowing what can go wrong, parenting columnist Jessica Saggio doesn't want to give up on what she believes is right about the sleepover experience.
You have to be balanced. You can't just trust anybody. You have to be careful about where your kids go and who they're with. But also, I am not a hardline no, because I want them to experience that side of childhood.
Her two older daughters, ages 10 and 8, are just starting to attend birthday slumber parties.
People were singing. People were running around.
The family was in our neighborhood. We know them quite well. Again, that mom had everything planned out. There was no wiggle room for shenanigans, if you will.
She says it was an overall good experience for her daughters. But experts warn, sometimes sleepovers are an opportunity for children to engage in high-risk behaviors while the adults aren't looking.
It's actually quite common for sleepover parties today for kids to jump online and engage in sexual communications with people. Bullying, very much so, whether they get together as a group at the sleepover and bully someone else.
or even target a child at the sleepover. So how can all parents ensure that sleepovers are safe, and when is it the right choice for your family? Licensed clinical psychologist Dr. Carolyn Ivers-Landis at University Hospitals in Cleveland says there are many things to consider.
How closely are kids being monitored? How safe is that household?
Dr. Ivers-Landis recommends focusing on the child's need for emotional security and comfort.
Some kids might wet the bed sometimes, so they're embarrassed to go to sleepover. Some kids might have fears at night or fears of the dark, so they're afraid to be away from their parent. Some kids just might like to do things the way things are always done, and so they're afraid.
And may need more time to mature before agreeing to a sleepover.
What about when there's a slumber party and your child is the only one who can't go?
So that actually just came up with our daughter.
The McElraths opted for what's called a late-over. Attend the party, but leave sometime before midnight.
Even if it's 10:30, 11 o'clock, she can stay over and come to the party and hang out with the girls, but we have somewhere to be early the next morning, so I need to come pick her up.
Ease into it. Try one of those late overs. Try letting them go till 10 o'clock, pick them up, and then start over the next time. Maybe we go a little bit later the next time.
But more importantly, if it's not the right time or a good fit for your child, don't force it.
They don't have to do a sleepover. You don't have to do it if you don't want to do it.
Once our kids are in high school, I would be fine with sleepovers, I think.
For now, the McElraths' no sleepover policy will stand.
Nothing good ever happens at night.
First and foremost, our job is not to be your friend, it's to be your parent and keep you safe. That's kind of how we landed on that decision.
If you decide your child is ready for a sleepover, consider these suggestions from the Child Rescue Coalition.
Make sure you know and trust the adults and that they will be present to supervise. Know who else will be there at the same time as your child. Studies show that 40% of children are abused by older children.
Have a pre-sleepover talk with your kids and check in on your child and allow them to call you. Also, designate a code word your child can say if they feel unsafe, so you'll know to pick them up immediately.
Still to come, the wonder of flight.
I was just amazed, like the little hummingbird in my hand, and I'm letting it go.
Before these birds go, they make an important pit stop. We explore the journey of the hummingbird and how one Louisiana neighborhood attracts dozens every year.
But first, healthcare workers face life and death decisions every day, but one serious concern isn't part of the job description.
I've been around where I've seen my coworkers kicked, grabbed, punched, had urine thrown at them.
We investigate violence against nurses and one state's solution to stop it.
Our in-depth coverage continues. You can get connected to Investigate TV Plus on all social media platforms. Punched, kicked, bitten, even stabbed. Healthcare workers across the country face violent acts while trying to help patients heal.
According to a May 2024 study by the CDC, healthcare workers make up 10% of the American workforce, but experience 48% of non-fatal injuries resulting from workplace violence.
It's become such an issue, Congress is trying to pass laws to help curb it, but there are two different bills being considered in disagreement on which one is best. On the one hand, the Workplace Violence Prevention Act would require healthcare employers to develop and implement a comprehensive workplace violence prevention plan. Supporters say prevention is key, and the best way to get there is safe staffing levels, an issue National Nurses United says is at the heart of the violence.
Safe staffing makes everyone safer, right? If you don't have time to be in your patient's room and you're rushing between patients, you're not going to be able to recognize those signs of escalation and intervene with that patient as early as if you were safely staffed.
But not everyone agrees. Claire Zangurli is the chief nurse executive for the American Hospital Association. That group is supporting different legislation called the Save Healthcare Workers Act, which would toughen criminal penalties for people who assault healthcare staff.
What we want this law to do is we want this law to keep people from offending. It's very much like having a police force in the hospital walking the beat, walking the units, so that there is that presence of that those officers on those units, and that deters the crime.
Congress has yet to take action on either proposal.
But in January of 2026, the state of Oregon enacted a law intended to address healthcare violence in ways that's never been done before.
Oregon lawmakers say it's designed to make sweeping changes in the industry, including requiring hospitals to provide annual training to employees and contracted security.
Reporter Adrian Thomas examines the new regulations and why some healthcare workers feel it could be a solution for a safer future.
Patrick Hennessy is a trauma nurse at OHSU in Portland, but sat down with us at the Oregon Nurses Association offices, speaking in his capacity as a union member. He shared some difficult experiences while at work.
I've been, pushed against a door. I've been threatened. I've been, called horrible. Have had a lot of terrible homophobic language sent my way. I've been around where I've seen my coworkers kicked, grabbed, punched, had urine thrown at them.
The new law instructs hospitals to create workplace safety committees made up of hospital administration and healthcare workers. It also sets up a mechanism for tracking data of violent incidents and reporting them to the Oregon Department of Consumer and Business Services. It also allows nurses to only use their first name on their badge if they choose to prevent doxing, and installing bulletproof glass in emergency rooms.
We really need rules in place and the state to really support healthcare workers, so that way if I wanted to work at a different hospital or go somewhere else, I can expect the same type of protections.
We also met Juliana Harder, a home health physical therapy nurse at Providence and an ONA member. She says the previously under-regulated environment of home health will hopefully be safer under the new law.
So you're literally going to a stranger's house that you've never met all by yourself. There has not been the mandatory reporting, which this bill will require a hospital that had an episode at the hospital with a patient to now share that information with a home health company going in.
Harder, who has been in home health for 30 years, loves the work she does because she likes how it allows patients to stay in the comfort of their homes if they have serious conditions. But she says it only takes one bad experience to understand how risky this work can be. One patient once threatened her with a firearm.
And I was sitting about 5 feet from a back door, and I just jumped up and ran out the back door. And I think of myself as, I've done this for decades, I'm very experienced, but as soon as I got to my car, I literally broke down crying.
Harder says after that incident, she did feel supported from her employer, and that patient was dropped from her care. However, under the new law, patients who have violent tendencies will be documented and reported to any future healthcare providers they might establish care with. Both healthcare workers who sat down with us feel the mindset changing among their colleagues will be key for a safer future in hospitals, doctor's offices, or any healthcare setting.
It's surprising how we have normalized violence, because many people would, the assault or a gun was violent, but getting slapped, pinched, spit on, sexually groped, people were like, that just happens. And that has to change.
The Hospital Association of Oregon also supported the bill's passage.
A spokesperson wrote, "Hospitals are places of healing. The Hospital Association is proud to support ongoing efforts to address workplace violence, including supporting the passage of SB 537 during the 2025 legislative session."
Still ahead, good deals and good deeds.
We work with the food bank some. We work with MIMO, which is a rehab center for young men with drugs.
We introduce you to a retired teacher inspired to use retail to help her community.
But first, hummingbirds fly hundreds of miles and rely on flower power to fuel their journey.
This has been probably one of the best migrations years that I can remember.
We explore a popular pit stop along their flight path.
You can watch Investigate TV Plus anytime online. Just subscribe to our YouTube channel at Investigate TV. You can catch stories and full episodes. They weigh less than a nickel, eat as much as 3 times their weight a day, and travel thousands of miles to find a temporary home.
Each year, the ruby-throated hummingbird embarks on 2 migrations. In early spring, these tiny birds fly north to the United States and Canada, and in the late summer and fall, they go to Mexico and South America.
Their migratory journeys can span thousands of miles and require an immense amount of energy, and it seems they found a spot to fuel up.
Reporter Dave McNamara takes us to a hummingbird rest stop in Louisiana.
At first light, just before sunrise, the air in this quiet Covington neighborhood is alive with wings. Dozens upon dozens of hummingbirds swarm the feeders in the backyard of Margaret Birdie Owens.
If you plant it, they will come. And there are specific hummingbird plants that I have. That's why I have so many hummingbirds.
The tiny birds are feisty. They seem to compete for control of the sugar-sweetened water in numerous feeders. And on this morning, Owens has invited dozens of neighbors, their children, and bird enthusiasts to enjoy the spectacle.
This has been probably one of the best migrations years that I can remember.
These ruby-throated hummingbirds are traveling from the Appalachian Mountains along the Gulf Coast through Louisiana on a long journey to Mexico, Central, and South America. There is work to be done, as some of the birds are enticed into cages and briefly captured to be banded by Nancy Newfield. She's been doing this for 46 years.
The band is on. You need to make sure that it can rotate around the leg and slide up and down.
Newfield checks each banded hummingbird's weight.
4.74.
And she measures their wings and gently blows back feathers to see how fat they are.
Fat is a 5.
Since 1979, she has banded 25,000 hummingbirds.
You and I first met 15 years ago on a very cold winter morning. I think it was close to 20 degrees. And here we are 15 years later. What have you learned over the decades?
Over the decades, I've learned that we have different hummingbirds coming into, staying, or going through Louisiana 12 months out of the year. She's ready to go and she will leave.
A highlight for the children and guests is being able to briefly hold a tiny hummingbird and letting it fly away.
It's so fast. Wow. I was just amazed, like the little hummingbird in my hand and then letting it go.
I do it for the kids. I want that to be imprinted in their brains so 30 years from now they'll remember, oh yeah, I'll take care of the birds.
This spectacle has been nearly 40 years in the making. Grooming the yard with bird-friendly plants and flowers, keeping the feeders filled, and then finding a way to share the excitement with others.
A hummingbird's power and small size allow tremendous agility in flight. They're the only vertebrates capable of sustained hovering, and they can fly backward and upside down as well. You really get a good sense of how small they are, though, when you see it like in the palm of someone's hand.
I love my hummingbird feeder.
Aw.
They look like little fairies.
Do they come visit you?
They come and visit.
Very nice.
To keep it full.
There you go.
Yeah. Well, up next, a thrift store where every dollar counts. Towards something greater, we introduce you to a former teacher inspired to provide deals for customers and hope for the community. After spending 3 decades as an educator, a former teacher in Virginia was inspired to teach her community a new lesson.
Barbara Daniels runs a thrift store that gives purpose to each purchase. Reporter Ashley Hendricks shows how she turns secondhand treasures into supports.
This is the men's section here.
No matter your age or your style, Cumberland Clothes Closet has plenty to choose from.
We sell mostly clothes, but we sell anything that's usable in a home. We do glassware, books, anything like that.
Gently used items are dropped off here, sorted, then tagged at reasonably low prices. Barbara Daniels says that's just one of the reasons she loves this store so much.
Ladies always have more clothing.
Barbara, who retired as a teacher from Powhatan County Public Schools, started the next chapter of her life volunteering at the store.
Volunteers. We're always looking for volunteers.
For 15 long years, she's led the group of volunteers, helping customers find what they need for the right price.
It's often difficult for them to clothe a large family with prices today.
At this store, every dollar counts towards something greater.
Whatever we make, other than what it costs to, keep the clothes closet open, goes back into the community. So,
Catherine Trammell, a friend of Barbara's, has long witnessed the growing need.
The county is limited as to what they have and where we have to go to get it.
Community support is what makes this store different from most. When customers walk out with bags in hand, they feel even better knowing they're helping their neighbors. Cumberland Clothes Closet has awarded $10,000 scholarships for students, supported the nearby library, and donated to volunteer fire departments all within the county.
We work with the food bank some. We work with MIMO, which is a rehab center for young men with drugs. We help them.
Barbara says this kind of support is all a team effort from volunteers and residents, and she's just grateful to help make a difference.
Our community is part of us, and we're part of them.
And that's it for us on Investigate TV Plus. I'm Lee Zurich.
And I'm Tisha Powell. Thanks for watching.
On the next Investigate TV Plus, an offer out of the blue for energy savings in a brand new AC unit.
What was the cost supposed to be? It never cost us nothing.
But when bills started arriving, these two women fought back.
You thought it was going to be a cost savings program. This would save you money.
That's what I thought it was. But we got ripped off.
We break down the signs you should know should a similar offer show up at your door.